An integrative medical approach involves taking conventional medicine and naturopathic medicine and bridging the gap. So essentially what we're doing is integrating these two paradigms of healthcare to create a more modern approach to healthcare, one that addresses the primary care needs of the patient, both from a diagnostic and pharmacologic perspective, but also addressing their other care needs from a more naturopathic perspective. For instance, looking at their diet and nutritional requirements or needs, looking at more of a preventative approach to healthcare.
Why integrative medicine? I think it's really important to look at the whole picture of a person. And it's really important to understand that there are different facets to people's lives and their health. There's the mental side, there's the emotional side, there's the physical side. And it's important to support all those different aspects and to take those into consideration.
So it's a completely different healthcare experience than what most patients are accustomed to, especially when they go to their GP. Oftentimes there isn't enough time with the GP, and so some of the knowledge transfer just isn't there, and so patients have these questions. And if you don't have your questions answered, you feel like you're not in control. You feel like this is something that you simply have to leave up to your doctor to make those decisions for you. Whereas when we're working with patients, because we take the time, we do have the time to offer to patients, they can be an integral player in what we decide to do going forward. We don't move forward unless the patient understands why we're doing what we're doing.
Integrative medicine isn't just, looking at, what your diet is or what medications you're taking. It's looking at all of that together and working with other physicians or other supportive people in your network to really attain the main goal of helping you achieve an optimal wellness or whatever that may be for you.
Oftentimes, patients will be going to their GP and feeling like they're just hitting a roadblock. They're not getting anywhere with their health. They're not getting the answers they need. They're not feeling well. When they come to see us, because we have access to private healthcare and private labs, we can often find the test that is required to gain that critical piece of information that helps us put the pieces of the puzzle together for the patient. And it's also important for me as a physician to communicate very closely and transparently with the medical oncologists, the GPs, the specialists, and let them know exactly what we're doing so that there's full disclosure, there's transparency. The more everyone knows about what is going on with the patient and what treatments they're being given, the better it is for the patient, the better it is for everyone else. As naturopathic doctors, we look at those individual layers. We look at things from a systems-based approach. So we evaluate, their hormones, we evaluate their digestive system, we evaluate their neurologic function. And in that framework, we also look at how they're dealing with stress. So if they're not managing stress well, there are multiple components to that. And so piece by piece, we take these things apart and we work with the patient. The first step is them feeling empowered, knowing that there is a solution to the way that they feel. They've got to be ready to do the work. They've got to commit to the plan. But if they do, within a short period of time, they start to experience the changes that are very positive and reinforcing for them. So then they want to continue with the plan to reach their optimal health or whatever their goal is for their health, and they're motivated to do that. In that framework, their stress becomes less of an issue. It becomes less of a factor, because part of the stress is just is in not knowing what is going on with me, not knowing why I'm dealing with this health concern, or how I can address that.
We have to think whatever method, as long as it's working for patients. We have to think that way, because nothing up till now is perfect for treating this disease. So that's why the idea of integration is there.
What I do is not alternative medicine, so this isn't an alternate to to standard conventional oncologic care, but rather it's to augment and complement the standard treatments. I think that patients who come to see me and choose that integrative oncology approach are very pleased that they did take that approach. And compared to other patients who might be diagnosed with a similar disease but don't choose that integrative approach, our patients do much better, and the scans, the lab reports, everything demonstrates that they're having a very positive outcome with the integrative approach. There's certainly a science to applying that integrative approach. So a lot of the treatments that we do are, I'm going to recommend on the basis of what their standard treatments are. So being very careful not to interfere with the efficacy of those standard treatments, but rather increase the success rate of those treatments, augment those treatments, enhance the overall outcomes, the anti-tumor response, so that we can collectively obtain and achieve the results that we're all seeking for that patient. Integrative oncology is becoming more and more widespread in North America. It's certainly an integral part of a lot of the cancer care models in other parts of the world, such as Germany and Asia. In North America, it is relatively new, but the evidence that we have demonstrates that patients who choose an integrative oncology approach, where they're seeing a naturopathic physician who specializes in oncology, as well as seeing their primary care oncologic providers, those patients have better outcomes. They have better success rates. They tolerate the treatments better. They have less complications, less adverse reactions to the standard treatments, and they also have reduced rates of recurrence and relapses of their disease. The patients often have a question around diet and what they should do in terms of diet when dealing with cancer or when undergoing cancer treatments. They're often told by their standard oncology team that diet doesn't matter, you can eat whatever you want. But from a sensible, logical standpoint, it just doesn't quite make sense to eat whatever you want during cancer treatment. And in fact, I have a very different perspective on diet and the role that it plays in treating the cancer. So diet on its own, I have to say, diet on its own can't cure cancer, and that's really important to know. And a lot of people will have this idea that diet or juicing or these different types of claims that are made on the internet, that juicing and diet can cure the cancer, and that is a dangerous game to play. I think diet is a very important component of cancer care, and there should be some emphasis on diet, but it certainly isn't a cure in and of itself. That's a good dietary approach because it reduces the inflammation in the body, and we know that inflammation is a hallmark of cancer. It's definitely a driver of cancer as a disease. And not just cancer, but a lot of different diseases, certainly diabetes, cardiovascular disease. We're learning that inflammation is often at the root of a lot of these chronic disease issues.